Hello everyone, my name is Nurse Lilian. I'm a registered nurse and midwife with over 10 years of clinical experience, trained in emergency care, patient education and life-saving interventions. Over the years, I have cared for patients with stroke, hypertension, pregnancy and pregnancy complications, and other critical conditions. I specialize in breaking down complex medical information into simple practical steps that anyone can understand and even apply. Today, I'm not just talking to you as a nurse, I'm speaking to you as someone who has seen people that have ignored warning signs. And that is why this session is very important. So stay with me to the end. We're going to go deep into stroke, how to recognize it early, what causes it, and what you must do immediately to save a life. This knowledge can make the difference between life and death. First, let's understand what stroke is. Stroke is a medical emergency. And when we say emergency, it means something that we don't waste time on to remedy. Now what happens? In stroke, something is causing reduced blood supply to the brain cells. Remember, the blood that is supplying the brain carries oxygen and nutrients to the brain cells. If there is anything causing a blockage or reduced supply of blood to that brain cells, which means it is starving of oxygen, it is starving of nutrients. Now, in stroke, something is causing a blockage, and when there is blockage, there will be reduced quantity of blood to the brain cells. That is one part. In the other part, if there is total cutoff, there is nothing blocking it. Maybe a clot blocks the blood vessels, which are very tiny. So which means there is total cutoff of blood supply to that part of the brain. What will happen? That part of the brain starts dying. Now, that is what we call stroke. It is an emergency. Now, we go to the types of stroke, which is 2 in number. The first one is ischemic stroke. In ischemic stroke, when blood vessel is blocked, it reduces blood supply to the other side of the brain. Is it not? Yes. So that is ischemic stroke. The blockade could be due to blood clots. When there is blood clots or air embolism, air is blocking the vein from flowing blood to the other side of the vein. That is one type of stroke. Then the second type of stroke is hemorrhagic stroke. In hemorrhagic stroke, the blood vessel has burst, so there is a total damage there. So in both cases, whether in ischemic stroke or in hemorrhagic stroke, there is stoppage of blood reaching parts of the brain. So the brain now suffers from lack of oxygen and nutrients. And when there is lack of oxygen and nutrients, what happens? The brain cells begin to die. And within minutes, there could be permanent damage. That is why early action is very necessary. Now, when there is reduced blood supply to the brain cells, before it finally starts dying, there are warning signs. And this warning sign, I need you to take your biro and your paper. If you don't have biro, use pencil. If you don't have pencil, use marker to mark it down. The warning signs you will have when there is reduced blood supply or damaged blood vessel in the brain. I want you to write FAST, which is fast. Now, F is for face dropping. A is for arm weakness. S is for speech disorder or speech difficulty. And T is time for action. We get it? FAST, fast. Now let's get to explain the first F, which is the face dropping. In face dropping, it's as if part of the face is not alive. You tell the person to smile. Normally, you see the person fine, the face, the complete face will show radiance and smile. But when there is a blockage or bleeding in the brain, the part of the face, half of it will look neutral. There is no feeling there. There is something like this picture we are saying. It is a warning sign. That is face dropping. The person is not in control of that face. Now, if we tell the person smile, and the person smiles, and the smile is like this one, or this one, or this one, know that the person is not in control of the brain cells at that point. There is a problem somewhere, and that is a warning sign. Now we go to arm weakness. In arm weakness, it is sometimes it's just not for the arm, it could even affect the arm and the leg, half of the body. Remember, it depends on the part of the brain that is being prevented from having blood supply. Now, what happens in arm weakness? The person cannot control the hand or part of the leg. Tell the person to carry the two arms up. You will notice that one arm is dropping. The person will say, this one cannot lift up. Sometimes even this hand that I carried up is too much. They can't lift it up much. There is something wrong somewhere. It is another warning sign. It could be the leg. The person cannot gain his balance. The person walks and falls. He is not in control. Remember what we said. We said F for face dropping, A for arm weakness. Now we'll go to the S. S is speech disorder. In speech disorder, the person cannot make simple sentences. The person will be talking, but you will not even understand what that person is saying. That is a speech disorder. It's also a sign that shows that there is stroke happening somewhere. I hope we are getting it. If at this point you are learning something or are making points, please write "go on" in the comment section. And if you have any question concerning what we have discussed, whether the cause of stroke, what stroke is all about, and now talking about the warning signs, you can also ask questions. And if you understand everything I'm saying, please tell me you are understanding. I should go on. Now let's go to the T. The T is time to act. We need to act fast. We don't need to delay. We don't need to start pouring water. No, you don't need to do those things. Time to carry this person fast to the hospital. No time to delay. I hope we are getting it. No time to delay. If you have learned something on this lecture, on this section, please tell us and give us a thumbs up. We appreciate. So you make quick arrangements on how to take this person to the hospital, the nearest hospital. Now, apart from fast, which is face dropping, arm weakness, speech disorder anytime, there are other warning signs. Another one is sudden severe headache. The headache will come either at the back or even at the front. And the headache, they describe the headache as so much that the pain is so much that it is the worst headache of their life. Another sign they might have is sudden confusion. They were doing something, but all of a sudden they become confused. Then another one is loss of balance. The person was standing, suddenly falls and cannot get up back again on the two legs. Or one of the hands, just all of a sudden, could not move again. That is loss of balance. Then we also have blurred vision. The person might either lose the ability to see with one eye or even both eyes, or one eye is blurry, is no longer clear, that is a warning sign of stroke. These signs that I have mentioned may come suddenly, so we should never, that is why we are having this session, we should never ignore sudden changes in the body. Now, assuming these changes happen and you are there, what do you need to do? Please take your paper and biro, if not biro or pencil, pen this down. Someone is having stroke. What do you need to do? Do not, please do not give food or water. You have seen these signs. Do not tell the person, go and sleep it off. We should not delay anything. Don't delay. Rush to the hospital immediately. Each time you waste will lead to loss of brain cells, which can lead to permanent damage. Now let's talk about the prevention. Don't drop your biro. Keep on writing. You can prevent stroke. Yes, it is possible. Number 1, control your blood pressure. Check your blood pressure. You watching me and you listening, when did you check your blood pressure last? Please be sincere and tell me. Number 2, reduce salt intake. After cooking the soup, you have cooked the soup. As you are eating, you not add salt again. Don't do it again. Just learn to eat that one you have used to cook the soup and avoid additional salt. Mostly when you know that you have blood pressure issues. Another one, exercise regularly. Exercise can never be underestimated. Please learn to take action in exercise. It could be 30 minutes of walk each day. It could be, if your place of work is not too far, leave home on time before the sun will come down and take a walk on it. That will help you. Then for those that can wake up on time like me, you can do your morning workout in early mornings before going to work. Another thing you can use to prevent stroke is, this will touch some people, and that is what? Smoking. Yes, just avoid smoking, because smoking can cause blood clots that can go to the brain cells and block it there. Another one is to regularly check your blood sugar. Do you know your blood sugar? When did you check your blood sugar last? Please tell me in the comment section. Be sincere. I'm not judging. Just let's do it together. Let's work on our health together. When did you check your blood pressure last? And when did you check your sugar last? Just tell me in the comment section. I will appreciate. Remember, prevention is always better than emergency. My mommy will say prevention is better than cure, and that is the best. Prevention is better than emergency. If you can prevent stroke by taking action, you will see that there will be no emergency. Now, if you must know, in my upcoming training sessions, I will go deeper into emergency care and practical response. If you are interested, make sure you follow and stay connected to this channel. If you are not still interested, it is also good to let me know and tell me what you would like me to discuss on. Drop your questions in the chat, and if you have any commendations too, remember to still drop it there. If this have helped you, share this video to other of your friends. You might be saving someone's life. Follow for daily health tips.